Hi, and welcome to the first episode on muscular and skeletal systems, word parts. I've selected some combining forms, suffixes, and other elements that I believe are important for these chapters. These are worth mentioning, but please be aware that this is not an exhaustive list of all the word parts we will cover. I think these represent the high points, common word parts, and possibly confusing ones. Let's start with some combining forms. Okay, we'll be going through these in alphabetical order, starting with ankylo, which means fused together or stiff. We'll use this term when discussing the spine. Arthro or articulo, these two combining forms share the same meaning, which is joint. Astheno, I had a list there. This combining form means without strength, so you can see that it has an A in it at the beginning, so technically it's not a prefix, but it does mean without strength. The next one is chondro. This refers to cartilage. It might help to remember that this is a bit alliterative. The next one is fixato, meaning that it means to make or to stabilize. So we'll talk about broken bones and fixation. And the last two here are kino or kinesio. And these two combining forms both mean movement. Next, we'll be looking at the following combining forms, again in alphabetical order. So the first one on this slide is malaco. This means softening, right? So we'll talk about bones being dense and malaco meaning an abnormal state of softening of the bones. We're going to have myoso, or musculo, and you can probably guess that they all mean muscle. The next one is myelo. This means bone marrow or spinal cord, so be careful not to confuse this with myo, which means muscle. It's a little tricky because when you hear it, it sounds very similar to myo. Typically when people read, they're able to visually pick up the difference. The next one's going to be ortho. This means straight. You might already know this is, if you've been to the orthodontist, it's a person who straightens your teeth. The next one is osteo and osseo. These combining forms share the meaning of bone. And the last one on this slide is sarco, which refers to a specific type of connective tissue. Next, we'll be looking at the following combining forms, again in alphabetical order. So we're going to start off in this slide with scolio, and this means curved or crooked. The following one is spondylo. This means vertebra. The next one is taxo, which refers to coordination. So we'll talk about ataxia, which involves a lack of coordination, especially with walking and gait. The next one is tropho. This means development. So we've seen this before, and we'll see it again. And the last two together are verto and verso. These two combining forms both mean to turn. All right, let's go through these suffixes in detail. And the first one is blast. This means, it refers to an immature cell. So for example, a leucoblast. This is an immature white blood cell. Leuco meaning white, blast meaning immature cell. The next one is centesis. The process of withdrawing fluid with a needle. So we've covered this one before, but it's always good to review again. For example, arthrocentesis is the process of withdrawing fluid from around a joint with a needle. Clast. This refers to a cell that breaks things down. For example, an osteoclast is a cell that breaks down bone. Desis, this means to fuse together. So this is often used when creating stability by fusing joints or bones together. The next one is oid, O-I-D. This means resembling. A way to remember this is the term android, right? Andro meaning man and oid meaning resembling. So the software that's on your phone, it technically means to resemble man. Right? Allisthesis, this means slipping. This is often used in context with the vertebrae. Or, as an OR, this refers to a thing that produces. So, for example, a ventilator, that produces movement of air. A motor produces movement. The next one is path. This refers to a person involved with disease. So, for instance, an osteopath. That's a healthcare provider who cares for someone with a disease of the bones. As opposed to pathy with a Y at the end. This refers to the disease itself. So, for example, osteopathy is a disease of the bones. We have a few abbreviations and acronyms in these chapters, so let's go ahead and go through them. The first one is AKA, above the knee amputation. I've capitalized the letters and the phrase that corresponds to the acronym for clarity here, but typically we wouldn't be capitalizing the phrase. So AKA stands for above the knee amputation. Now, what do you think BKA is, right? I hope you said below the knee amputation. Again, this simply means the landmark that's used for amputation. So BKA, below the knee amputation. What about DJD? That stands for degenerative joint disease. So saying DJD is much easier than the actual phrase. The next one is capital FX and then capital F little x, right? So that just refers to fracture. So whether in all capitals, like capital F, capital X, or just capital F and lowercase x, they both mean fracture. The next one is capital LLE and then capital LUE. They both mean, left lower extremity for LLE and left upper extremity for LUE. The next one is NSAID. The abbreviation is capital NSAID, and this stands for non-steroidal anti-inflammatory drug. And you might have heard this on commercials. So, but an example of an NSAID is like Aleve or Motrin, which are typically over-the-counter medications. Note that non-steroidal, as said here, is one word, and I've capitalized the S also to help you see it clearly. The next abbreviation is ORIF. This stands for Open Reduction Internal Fixation. So we'll go over exactly what this involves in the next couple of lectures. The next one is OA, and this stands for osteoarthritis. The next two pair are RLE and RUE, right? So we discussed LLE and LUE, so you probably can guess what these mean. RLE is right lower extremity, and RUE is right upper extremity, respectively. So it's, very similar to LLE and LUE. The last one on this slide is ROM. If you work in computers, that might mean something different to you, but here in medical terminology, especially with musculoskeletal, ROM stands for range of motion. So joints provide us with different degrees of range of motion, and this term refers to the ability of a joint to move within the expected range. Great, so that's a wrap for the first episode. We're going to go ahead and move on to anatomy next. Whether it's just a few minutes or a few days from when you stop this lecture, I will be here and ready to continue whenever you are. So, talk to you very soon. Hello again and welcome back. Let's dive into our second episode for this series of musculoskeletal, where we'll be discussing the musculoskeletal anatomy. So it's an exciting topic with lots of fascinating details to cover, so let's go ahead and get started. Let's start with bone structures. So we have some basic external structures and some internal structures to discuss. Externally, every bone has two epiphyses. Remember, the singular is epiphysis. It sounds the same, but spelled differently. You have one on each end of the bone, so be careful here. You might see the prefix epi and think it means above, but in this case, it refers to both ends of the bone. So for example, in the femur, both the upper and lower ends are considered epiphyses. Right. The next one is diaphysis. This is the shaft or the long portion of the bone. In addition to epiphysis and diaphysis, there is also something called the periosteum. The prefix here, peri, means around, so the periosteum is a covering that surrounds the bone. Internally, there is an epiphyseal plate, also known as a growth plate. So this plate is associated with bone growth. For example, when a baby grows from 22 inches to an adult height of, let's say, 6'2" or 5'8", which is pretty tall. It used to be, at least. A lot of changes occur in the bone structure, and the epiphyseal plate is where this growth originates. So there's also the medullary cavity, which we'll discuss more in the hematology chapter. Long bones often contain red bone marrow, which plays a crucial role in blood cell production. So most bones, however, contain yellow marrow, which is fatty. Recently, serving marrow on toast has become a trend in restaurants. Some of you people who hunt, you hunters, you might already be familiar with this. Yellow bone marrow or yellow marrow it's known for its high fat content. So those of you who hunted a lot, when you were young, you probably used to put marrow on your toast, whether if you knew it or not. People loved it. I don't know what it tastes like. Let's delve into bone physiology. We often think of bones primarily as a collection of minerals, which is true. Calcium is the primary mineral stored in bone. So while there are other minerals for our discussion, we'll focus on calcium. So 95% or closer to like 98, 99% of the calcium in your bone, in your body is stored in the bone. This storage is very crucial because it gives bone its density, its durability, its toughness. We have things called osteocytes, right? Osteo means bone, and cytes, if you remember, means cell. These are responsible for maintaining the density of the bone. And there are different types of osteocytes. So, for example, we have something called osteoclast. These are cells that break things down. Remember that clast means to break down. So an osteoclast they're crucial for your body. They're crucial for your body to withdraw calcium from the bone and have it circulate in the blood if you're not ingesting enough calcium through your nutrition. Muscles also depend heavily on calcium for contractility. So osteoclasts will ensure that your serum calcium levels never get too low in case you go through a time where you're not ingesting enough calcium through your diet. Osteoblasts, right? These are immature cells that eventually mature into osteocytes. Osteoblasts, they build the bone back up. So while osteoclasts break bone down, osteoblasts work to build it up. This is an ongoing process of breaking down and building up, and this continues throughout your entire life, even after reaching your mature height. So there's a constant dynamic process of bone remodeling happening all the time, and this is to ensure that your bones remain strong and you always remain functional. Let's dive into classification of joints, right? Focusing on their mobility. So let's talk about the types of joints. We have a suture joint, a symphyseal joint, and a synovial joint. So suture joint, these are like jigsaw puzzles where two bones fit together very tightly with no movement. A joint is essentially where two bones communicate with each other. So in suture joints, the ends of the bones fit together very neatly like pieces of a puzzle. There's no movement at all in the suture joint. So, for example, the coronal suture and the sagittal suture in the skulls, these are examples of suture joints. These sutures help you visualize the sagittal plane and coronal plane that's been discussed earlier in this course. The next one is symphysis or the symphyseal joint. Right, these joints allow a little more movement. There's a small amount of cartilage between the bones, but they don't provide a great range of motion. Examples will include the symphysis pubis, the joints between the vertebrae. So while there's some cartilage and a bit of movement in these joints, it isn't very much. And then the last one will be a synovial joint. So when people talk about joints in general, they usually think of synovial joints. These are characterized by two bones coming together with cartilage in between and a cavity around it that's filled with synovial fluid. So this fluid is contained within a synovial membrane. These are the things that people pop. If you ever see people popping their bones, all of these, if you pop it, it's most likely a synovial joint. All right, so synovial joints, like those in the knees and the elbows, they allow for a large range of motion. I was going to say a lot and a large range of motion. So when you flex and you extend these joints, you can see the significant range of movement that they provide. But don't pop your joints. I am told that is not good for you. All right, let's talk about muscles and their classification. So the classifications of muscles. There are three major groups of muscle that we're going to focus on: skeletal muscles, cardiac muscles, and smooth muscles. So let's go to start off with the first. Skeletal muscles, these are also called voluntary muscles, meaning they're under conscious control. So actions like walking, driving, making toast for breakfast, these are all controlled by skeletal muscle. The next category or classification is cardiac muscle. These are unique muscles found only in the heart, hence the name cardiac. Right? So cardiac muscles have a special function called automaticity, right? Which is the ability to create their own electrical pulses. So this feature is exclusive to cardiac muscles. It differentiates them from other things like smooth muscles, and we'll cover more cardiovascular muscles within the cardiovascular chapter. But it's just important to understand here the different classification of muscles and just to understand that there are different classifications of muscles. Right, the next one, or the last one, will be smooth muscles. And these are involuntary muscles as opposed to skeletal muscles, which were voluntary muscles. Right, so smooth muscles, involuntary muscles. And it just means that they are not under conscious control. Smooth muscles help with essential functions like digestion. Right, you don't want to be thinking about digestion and forcing yourself to digest. Things like breathing. Right, wouldn't you just like to breathe normally without having to think about it? And then other organ activities. So for example, smooth muscle ensures that bile is released after you eat, so without you having to consciously think about it. All right. Let's talk about some related structures that are important for understanding the musculoskeletal system. So the reason we're covering these chapters together, muscular and skeletal, is that these two organ systems are so closely related that separating them can be tricky, right? So here's how they interconnect. And they interconnect through tendons, ligaments, bursa, and fascia. So the first one we mentioned was tendons. These attach muscles to bone. So tendons attach muscles to the bone. So while muscles are responsible for movement, they need to be connected to the skeleton to facilitate movement. And the tendons are what's used to accomplish this. Ligaments are the next thing that we're going to talk about, and these connect bones to bones, right? So ligaments connect bones to other bones. To remember this, think of the word ligament, which has 8 letters, just like bone, right? Bone, B-O-N-E, B-O-N-E. That's going to sound a bit dorky, but if it helps you differentiate between tendons and ligaments, then so be it. Ligaments, they're not interchangeable with tendons, by the way. They have distinct functions. Ligaments connect bones to each other, while tendons connect bones to muscles, and the fibers are different, right? The next one is bursa, and these are fluid-filled sacs located in certain joints to help reduce friction between the articulating joints, right? So they contain synovial fluid, and they're found in places like the knee. And the last one on this slide is fascia. This is a very thin connective tissue that joins muscle to tendon, and sometimes fascia compartmentalizes groups of muscles. So that was a solid overview. Great job getting through it. Next up is the lecture 3, where we're going to dive into health and wellness and some diseases. So feel free to reach out if you have any questions or you need any further clarification on anything. And see you on the next lecture, either in a few seconds, minutes, hours, or days. It's up to you. Hi there, and welcome to Lecture 3. You're halfway through this chapter, so great job. In this lecture, we're going to be focusing on health, wellness, and some disease related to the chapters. Let's dive in and explore these important topics together. If you have any questions along the way, feel free to ask. Of course, this is a recording, so you can't ask, but reach out to me. All right, let's get started with bone and cartilage disorders by discussing some of the more common terms. So first, let's go to start with bone and cartilage disorders. The first one is osteoma, right? Oma means tumor, if you remember that. Osteo just means bone, so this refers to a tumor of the bone, and it can be cancerous or benign. The next word is osteomalacia. Remember malacia meaning softening, right? IA is just that suffix that means pertaining to or condition or state of. And osteo means bone. So osteomalacia is a condition of bone softening, often related to calcium or vitamin D deficiency. Next term is osteomyelitis. Remember that itis means inflammation or infection. And in this context, myelo refers to bone marrow. So osteo means bone. And putting it all together, osteomyelitis is an infection of the bone and bone marrow. This results in deep internal bone infection. The next one is chondroma. Again, I'll break it down. Oma means tumor. Chondro refers to cartilage. So chondroma is a benign, non-cancerous tumor of the cartilage. The next one is chondromalacia. Remember, malacia means softening and chondro means cartilage, so chondromalacia refers to the softening of cartilage. It's commonly seen in runner's knees, such as patellar chondromalacia, where repetitive strain affects the cartilage in a synovial joint. And then we have a fracture. So a fracture is a break or a crack in the bone, and I'll talk about a few fractures after I finish the last term here. And then osteoporosis, right? Osis means abnormal condition. Poro means porous, right? So osteo refers to bone. So osteoporosis is an abnormal condition where bones become demineralized and porous, like Swiss cheese. Yeah, I think it's Swiss cheese. So it's common in postmenopausal women, but can occur at other life stages due to various causes, and some medications can actually cause this. So your book is likely to make a comparison showing images where you have healthy bone with good bone density, and then it'll show a nice comparison of what an osteoporotic bone would look like. And as promised, let me go ahead and talk about some of the fractures. So a fracture, again, is a break or crack in the bone, and some of the more common fractures are something called a simple fracture or a closed fracture. This is where the bone is broken, but the skin remains intact, so bone doesn't protrude through the skin, right? It stays within the skin. Hence closed fracture or a simple fracture. A compound fracture, or also called an open fracture, this is where the bone breaks and pierces through the skin, and this can lead to an increased risk of infection. Remember, the integumentary system is that barrier for protection for the body. We have something called a comminuted fracture. The bone in this case is shattered into multiple pieces. We have what's called a green stick fracture, and this is a partial fracture where one side of the bone bends. It's common in children due to them having more flexible bones. The next one is transverse fracture, and here the fracture line is horizontal, so it's going straight across the bone. Then you have an oblique fracture, right? These are discussing the direction of the fractures. So the fracture line is diagonal across the bone. You can also have a spiral fracture where the fracture spirals around the bone, so often caused by a twisting force. Think of like basketball players, and maybe tennis players. I'm not sure. People who put a lot of tension, torques on their lower extremities. We have something called a stress fracture. So probably amongst weightlifters. This is where you have a small crack in the bone and it develops from repetitive motion or overuse, like maybe those long distance jumpers, those heavyweight lifters, power lifters, things like that. We have a pathological fracture. So this is a fracture that's caused by a disease that weakens the bone, such as osteoporosis or sometimes cancer. And then we have a compression fracture. So this occurs when the bone is crushed, and it's typically seen in the vertebrae. So hopefully you enjoyed that review of some common fractures. Okay, let's discuss some disorders of the vertebra. So vertebral disorders. The first one is ankylosing spondylitis. So remember, itis means inflammation or infection, spondylo means vertebra, and ankylosing means crooked. So ankylosing spondylitis is a chronic degenerative condition that leads to a crooked spine. It takes a long time to develop and is characterized by inflammation and fusion of the vertebrae. The next one is kyphosis, right? Remember again, osis means abnormal condition. Kypho refers to a bent or a humpback. So kyphosis refers to a hunchback or results in hunchback appearance. So this is where the shoulders are bent forward. It's sometimes referred to as dowager's hump, and it commonly affects older women. The next one is on the list is lordosis. So this is the opposite of kyphosis. It affects the lumbar region or the lower part of the back. Lordo means sway back, and lordosis is characterized by like an exaggerated inward curve of the spine in that lumbar area. The next term is scoliosis. So scolio means curved or crooked. So scoliosis is an abnormal side-to-side curvature of the spine. It often appears around puberty. So unlike kyphosis, which bends the shoulders forward, scoliosis involves a lateral curvature. And then we finally have spondylolisthesis. So listhesis means slipping and spondylo means vertebra. So spondylolisthesis is a condition where one intervertebral disc slips out. So slip disc, basically. And it can lead to pain and discomfort in that affected area. All right, let's go ahead and move into joint disorders. So the first one on the list is sprain. And a sprain affects the ligament around a joint. So it occurs when there's a stretch or tear in the ligament, and this is due to repetitive stress or maybe some sudden injury, sudden injury. And then they're often confused with strains, which we're going to discuss when we talk about muscles. Arthralgia, remember, the term for pain is algia, and arthro just means joint, so it doesn't specify the cause of the pain, it just refers to joint pain, which can range from like anything from the flu or overuse of the joint or something like tennis elbow. The next term is osteoarthritis, and this involves inflammation of both the joint and the bone. It's also known as degenerative joint disease, or DJD, if you remember the abbreviations. And it commonly affects older adults and can cause stiffness and pain, especially in the morning. Osteoarthritis is often seen in commercials for pain relief medications, like Aleve. But remember, those are non-steroidal anti-inflammatory drugs, so they do nothing to reduce the inflammation, but they do help you reduce the pain. So I bring that up because taking the Aleve doesn't mean you should go right back to work. It just means it's going to help you reduce the pain so that you can rest and get better. Most people take the leave and then they continue working, which kind of agitizes the condition. All right. Anyway, the next term is rheumatoid arthritis, and this is an autoimmune disorder that causes inflammation of the joint. So unlike osteoarthritis, the body attacks its own tissues, and this leads to red, swollen joints. It most commonly affects the hands and the feet, but it can affect any joint. So the term rheumatoid refers to the watery discharge that results from the swelling. The next term we have here is gout. And this is a type of arthritis that typically affects the big toe. And it's caused by the buildup of uric acid in the blood. So this leads to something called hyperuricemia, which means too much uric acid. Too too much uric acid, right? And emia means blood, right? Uric means acid, and emia means blood. So what happens is you get uric acid crystals. They accumulate around the joint, and that's what causes the pain. You can relieve this through, long-term through dietary changes. You can take medication that can help manage gout by reducing uric acid levels. And then the last term, which we've kind of already mentioned, hyperuricemia, right? So this is that condition of having too much uric acid in the blood. And again, it's the precursor to gout. ABCFG. Yeah, I could have put this before. I couldn't put this before gout because we're going in alphabetical order. So it's kind of just the way it is. But again, it's a precursor to gout, and it can lead to that formation of uric acid crystals in the joint. Thank you very much. Okay, let's talk about some muscular disorders. And the first muscular disorder we're going to discuss is strain. Remember we said sprain when we were dealing with skeletal disorders. But strain is something that affects the muscles, and it's due to overuse or overstretching of the muscle. Think of it as straining when you're working out with weights, right? It results in muscle fatigue or injury. The next one is myalgia. So this means muscle pain. So myo meaning muscle, algia means pain. So the pain could be due to overuse. It could even be due to things like the flu, if you ever had muscle pain during the flu season. Or it could be other causes, but it's generally just muscle pain. The next term is fibromyalgia. And this is a specific type of muscle pain characterized by pain at very specific trigger points in the muscular system. So people with fibromyalgia, not myofibralgia. So people with fibromyalgia, they experience widespread pain and tenderness. The next term is atrophy. So if you break it down, trophy means to develop, and then the prefix a means without. So this means without development. So atrophy is a condition of muscle wasting or loss of muscle mass, and that's due to lack of use. If you've ever gone a long time without exercising, you'll notice that you can't just get back into it because you've lost a lot of muscle mass, whether you're a weightlifter or whether you're a runner or anything that, prevents you from lacking use of your muscles. So a good example for medical would be if someone's bedridden and, they can't move, they can't get out of bed, and they're resting and recuperating. In that meantime, while they're recuperating, their muscle mass is being dropped. Another good example, probably more common example now than it was in the old days, was an astronaut, right? So an astronaut is in space. They're experiencing microgravity, so they don't have the full gravity force effect. And so almost being weightless, there is no stress on the muscles for them to rebuild. And so astronauts who spend a lot of time in space, they can develop very weak muscles. Okay, the next word is avulsion, and this refers to tearing away of a muscle from its point of origin. So usually due to trauma. It's a severe injury, and it usually requires immediate medical attention. And the last one is contracture. And contractures where muscles need to be used regularly, because contracture occurs when muscles are not being used. And again, back to something like the bedridden patient, right? The bedridden patient can't move and exercise their muscles, but it's a little worse than the astronaut. The astronaut can at least move and flex around and float around. The bedridden patient is probably stuck in one position, and they need to be moved by a clinician. So they develop something called contracture. So even though you have electrical impulses, the muscles start becoming very tight. They start becoming shortened. So you need proper positioning, and you need physical therapy to prevent contracture. So a patient who is bedridden, the more bedridden they are, the more immobile they are, the more you have to pay attention to their bed position and so forth. All right, great job getting through this material. Our next lecture is going to cover procedures. And as always, feel free to ask any questions you may have. I'm here to help you. You can reach me through my email. All of my contact information is, it's on the course. And so I'll talk to you soon. Or you'll see me in a few seconds if you click the next video. Hello and welcome to the final lecture covering musculoskeletal. So today we're going to be discussing surgical and medical procedures related to the musculoskeletal system. You know the drill, so let's get started. Alright, so you know the drill. Let's get started. Surgical procedures. Let's begin with some common surgical procedures related to the musculoskeletal system. And one that immediately comes to mind is amputation. So amputation refers to the surgical removal of a limb or a digit. In the United States, the leading cause of amputations is vascular disorders, and the most common cause of these disorders is diabetes. Diabetes is also linked to gangrenous infections, which can further complicate the need for amputation. And amputation has been performed for thousands of years and involves that surgical removal of an arm, leg, finger, or toe. So we have evidence of this throughout history. The next one is arthrocentesis. The suffix centesis means to withdraw fluid with a needle. So arthrocentesis is a procedure used to withdraw fluid from a joint, usually for diagnostic purposes. So sometimes it's performed to relieve pressure when excess fluid builds up in the joint due to some underlying disease. The next one is arthrodesis. This is a procedure where, remember that arthro refers to joint and desis means to fuse. So this is a procedure that involves fusing two bones at a joint to create some stability or improve stability. So it may be done in cases like spinal surgeries using things with the vertebra or the vertebrae. So after you have some traumatic injury, for example. So what we see here in the image on this slide is arthrodesis, which is performed with tarsal bones to provide more stability in the joint. Now we have the next one, arthroscopy. And this is a minimally invasive procedure to view the interior of a joint with something called an arthroscope. And so an arthroscope is a small specialized instrument. It's inserted through a small incision to examine the joint. And arthroscopy is often used to diagnose injuries, traumas, or certain disease processes. So remember, scopy, if it ends with a Y, it's the procedure. A scope, it just refers to the instrument. Pretty much anything that ends with a Y is a procedure. Well, not anything, mostly. Graphy, scopy, things like that. So this technique, what it does is it eliminates the need for large incisions and it reduces recovery time so the patient can recover quicker. Then the next term is arthroplasty. This is the surgical term, the medical term, for surgically reshaping or reconstruction of a joint. It's commonly referred to as joint replacement surgery. So when you have a damaged knee, that's you have a joint replacement there. So the goal of arthroplasty is to improve the function and reduce the pain in the affected joint. And again, just to summarize the procedures we discussed: amputation, arthrocentesis, arthrodesis, arthroscopy, and then arthroplasty. Okay, so if you thought we were done, think again. Let's go ahead and continue with surgical procedures, and we're going to discuss additional ones related to the musculoskeletal system, starting with fasciotomy and fasciectomy, right? So fasciotomy refers to a surgical procedure where an incision is made in the fascia, I'll say fascia, what this does, it'll relieve pressure, especially in cases where you have compartment syndrome. This is where you got swelling or bleeding and it occurs within a muscle group that's enclosed by fascia. This helps to alleviate the pressure and it prevents damage to the muscle and the nerves. And on the other hand, we have the other term, fasciectomy. They kind of sound the same, fasciotomy, fasciectomy. If you remember the word ectomy, right? This involves a surgical removal of all or part of the fascia. And this procedure might be necessary in cases where the fascia itself is causing the problems, such as with chronic infections or deformities. The next term is reduction. And this is a process of realigning a broken bone. So when bone is fractured, the goal is to put it back into its correct anatomical position so that it can heal properly. Reduction can be done in two ways, either a closed reduction or an open reduction, right? So closed reduction is a non-surgical method, and this is where the bone is realigned without making an incision. So you get an examination with an x-ray, and if the bone is not displaced, the physician can apply a cast to immobilize the area and just let it heal on its own. An open reduction, this is where the bone is displaced, and it requires physical manipulation. So in an open reduction, when it becomes necessary, there's a surgical procedure where you have to make an incision, you have to access the bone, and this allows the surgeon to, physically, manually realign it properly before closing the incision. We also have fixation. This is often performed in conjunction with reduction, so it involves using surgical hardware to stabilize broken bone while it heals. And like with anything else, there's several types of fixation, two types of fixation. The first one is an external fixation and an internal fixation. So you can maybe start guessing what this looks like. So in an external fixation, in this procedure, the hardware, like the pins and rods, they're placed outside the body to hold the bone in position. So this can be used for fractures where the bone is broken in multiple places, as an example of a tibial fracture, the external hardware is removed once the bone is fully healed. You can also have something like called an internal fixation, and in this case, all the hardware, the plates, screws, rods, all that's inserted inside the body to stabilize the bone. So these devices are implanted beneath the skin, and there's no external hardware that's visible once the procedure is completed. But patients have often said they can feel it, and the patient shouldn't try to feel it, especially when there's screws and they can feel the edges of the screws. You just try to get them not to touch it. It freaks them out a little bit. So finally, we have myopathy or tenorophy, and this refers to the surgical suturing of muscles and tendons, respectively. So the suffix "rophy" refers to the process of suturing, and these procedures are typically performed when muscles or tendons are injured or they're displaced, often due to some trauma, and they need to be reattached or repaired as part of some larger surgical procedure. So let me go and summarize these because we just talked about a lot of them. So fasciectomy was the removal or part of the fascia. Fasciotomy, that was the surgical incision of the fascia to relieve pressure. We talked about reduction, the process of realigning the broken bone. Two types of reduction were closed reduction, open reduction. So closed reduction was realignment without surgery. Open reduction was realignment with some surgical incision. Then we said fixation, right? Fixation in general is just to stabilize broken bone with hardware. And we had external fixation, internal fixation. External fixation was hardware when it's placed outside the body. Internal fixation was hardware when it's placed inside the body. And we ended up with myopathy and tenorophy, and these are suturing of the muscle and suturing of the tendon, respectively. Oh my gosh! Right, you all have I'll see you in the next slide. Thank you very much. And now we are at diagnostic procedures. So let's explore some diagnostic procedures used to assess issues within the musculoskeletal system. So one of the key diagnostic tools is electromyography. So remember when you hear the word graphy, that refers to, in this case, a recording, and where gram refers to an image produced, but if I say graphy, electromyography, graphy, it's a procedure, right? As where an electromyogram is that product, it's the image. Right, so electromyography involves recording the electrical activity of muscles, and this is used to assess how muscles are responding to electrical stimulation. The resulting image or the recording is known as the electromyogram. And again, it's just the recording, and this provides valuable information about muscle function, and it can help identify conditions affecting muscle health. The next term is arthrography, and remember again, graphy ends with a Y, so this is a process or procedure. So arthrography refers to the process of imaging a joint. Right? The term arthrography involves using some kind of contrast material to create detailed images of the joint, and the resulting image is called, and you guessed it, arthrogram. Right? Gram is just that image, where arthrography is that process, right? Or procedure. And so this procedure helps diagnose joint issues such as tears, inflammation, or structural abnormalities. So for evaluating bone health, we can do bone density testing, and this is commonly used, especially for diagnosing things like osteoporosis, and that was a condition where bones become demineralized and they become fragile. It's the Swiss cheese-looking bone. And what they do with bone density testing is that it typically focuses on areas like the hip and the vertebrae to measure the density of the bones and assesses the risk of fractures or bone weaknesses. We can do a blood analysis. And you're thinking, why blood analysis? Well, a blood analysis can also provide valuable diagnostic information. So there are key markers that are released into the blood during musculoskeletal diseases, and we can search for the traces of those blood markers. So for example, one of them is CPK, which is called creatine phosphokinase. And this is an enzyme that's found in muscles, right? It's elevated levels of CPK in the blood. This can indicate muscle damage or disease. Another one is troponin, and troponin is an enzyme, and it's specific to cardiac muscles. So it's primarily used to diagnose heart conditions. If you have elevated levels of troponin, this can provide important information in cases involving muscle damage. Then you have rheumatoid factor, RF factor, or rheumatoid factor, and this is a broad class of antibodies that can be detected through blood tests. So rheumatoid factor testing, this is especially useful for diagnosing rheumatoid arthritis for sure, and other autoimmune disorders that affect the joint. So if these antibodies are elevated, it may indicate the presence of rheumatoid arthritis, particularly if the patient is experiencing arthralgia. Remember, arthralgia being joint pain. Okay, again, we mentioned quite a bit of things here. Let me go ahead and do a review. So reviewing our diagnostic procedures, we said there's electromyography. Again, remember, graphy is a procedure. So electromyography is a recording of the electrical activities of the muscle as opposed to the electromyogram. And I know you use gram in chemistry for a measure of mass, but in this case, a gram is an image. So electromyogram is resulting in the image or data from the electromyography. Kind of like electrocardiography for recording of the heart, and electrocardiograph or electrocardiogram, which is a recording of the heart. Right? And that isn't too far off from our subject here, because again, that is a muscle as well. Arthrography, we said, was imaging a joint to assess its structure and function, right? The procedure or the process of recording the joint, arthrography, as where the arthrogram is the result, the image, the actual thing that gets produced. We had bone density testing, which is a test to assess density of bones, and it's commonly used to diagnose osteoporosis. And then we ended up with blood analysis. We talked about CPK and rheumatoid factor, right? Blood analysis is just laboratory testing of blood for various markers. And we talked about, CPK, which is an enzyme released into muscles by elevated muscle disease, right? And then rheumatoid factor are antibodies used to help diagnose rheumatoid arthritis. Okay, and just remember that all of these require medical instrumentation, and these are the things that clinical engineers work on in hospitals, not specifically the biomed technicians work on the equipment specifically, or directly, as where the clinical engineers know how to work on these equipment, but they're focused more on quality assurance and more like on engineering and analysis to determine the efficacy of equipment. So if you need to make new purchases for equipment, they have data to kind of go off of, and also like how to save money for hospitals when it comes to healthcare technology. All right, I don't want to get too far off topic because I tend to do that. Let me go ahead and stop this here. And so there you have it. Great job, everyone. We're all done with the lecture for today, or for this subject. So here's what you need to do now that we're done with this section. You have exercises and homework to do. You have word building exercises, quizzes, or whatever I may have put out there for this particular chapter. That's going to help you remember the information a lot better. So I always like to give you multiple attempts on these exercises because they're learning exercises. If you don't get it right the first time, try again so that you ingrain this information in your brain. I think that's all I have. So there's nothing else. No questions. Obviously, this is a recording, so you can't ask me any questions. Let's go ahead and get cracking, and feel free to reach out to me anytime with any comments, questions, or concerns. Thank you very much. This ends this section.